Hi everyone, my name is Gav. I'm a George Brown nursing student at George Brown College. I'm here with my colleague Annie.
Hi, my name is Annie, and I'm going to be giving Gab the consent to. I agree.
So perfect, we're doing a neurological exam. In addition, we're also doing the 12 cranial nerves too as well. I have here a cheat sheet, but I'm also going to put it on the side. I'll let you guys know if I'm going to review it or not. The first thing I'm going to ask is the full name of the patient and the date of birth.
My name is Annie Wayne, and July 22nd.
Perfect. Do you know what time it is right now?
It's like 9 o'clock.
Okay, good. And so when we're assessing the patient's mental capacity, we're looking at the appearance as well. We're looking at the behavioral, we're looking at the cognitive area, and we're also looking at the thought process. So Annie, appearance, well-groomed, looks good. When we're looking at the behavioral, she is calm and collected, and also cooperative. When we're looking at the cognition, she is alert and oriented, and when we're looking at the thought process, she is intact. Good. So I'm going to ask some suggestive data. So, for instance, have you had any history of seizures, head injuries, massive or severe headaches, any tremoring? Okay, and any weakness in particular?
No.
Okay, perfect. So now that that subjective data is collected, it's within defined limits and it's normal. So we're also going to go through the 12 cranial nerves in order. We're going to look at first the olfactory. So can I have you close your eyes, and then I'm going to present to you two items in which you'll describe to me what they are, okay? So I have this first one right over here. Perfect. So that's toothpaste. And then what's this one?
Flour or something?
Yeah, that's perfect. So I actually have here flannel, a hand sanitizer, and because of that, she has no abnormalities with her sense of smell, which is in defined limits. Then we're going to go to the optic nerve. So can I have you cover one of your eyes, and then you can look straight at me at my nose. I'm going to have my hands outward, and you just tell me how many digits I have, okay? So I have here
2,
good,
3,
good.
4.
Okay, and is my face blurry or normal? Good. And then I'm also going to have my fingers outward, and I'm wiggling. You just tell me when you see the wiggle.
Yeah, I see it.
Good.
See it.
Good. Let's switch over to the other eye. Okay. How many fingers?
2,
Okay.
2,
Good.
1.
Okay, and can you see the wiggling? Let me know.
Yep.
Okay.
Yep.
Okay. So with this, her peripheral vision is within a normal range, and good to go. So the next thing we're going to focus on is the oculomotor, also the trochlear, and then the abducens. And the test that we're going to use is going to be the corneal light reflex. So basically we would have a little pen light. I would have the patient looking at me straight, and I would slowly get the light down. And if there is bilateral light coming from both lenses, we know that that's normal. There's no signs of exotropic vision or endotropic. That's when we don't see the unevenness of the light reflecting. So right now I see that both eyes are reflecting the light. That means that it's within normal range. So the next one we're going to go to is the trigeminal, which is 5. And basically, is it okay if I have myself touch your cheeks?
Yeah, sure.
Okay, good. So I'm going to have you just clench your cheeks for me. Good. And so while I was feeling her mandibular muscle, I felt equal and bilateral strength, which indicates it's normal and within defined limits. We're going to go down to the 7th, which is the facial nerve. And so can I have you close your eyes for me really tight? Good. Now can I have you puff up your cheeks for me really big? Okay. And then can you smile for me? Perfect. So we have like equal and bilateral evenness, which is in defined limits. 8 is auditory. And basically, I'm going to have myself whisper to the patient in one of the ears, and I just need them to say in a normal voice what I've said. So can you cover your right ear for me? Perfect. And then you just tell me, okay, what I've said. Good. She said cake.
Cupcake.
Good. That's perfect. So that's normal and within defined limits. Next, we're going to go for the 9th, which is going to be the glossopharyngeal. So with this one, I actually have here a tongue depressor that I'm going to be placing on the patient's tongue. And I'm going to check for the uvula if it's midline or centered. So can you please open your mouth for me? Good. Can you extend your tongue? Good. And I'm just placing it. And I do see that the uvula is centered and midline, which is within defined limits. We're now going to go to the vagus nerve, which means I may have my hands on the patient, and I just want them to say ah for me. Good. And I'm also going to place my hands on the hyoid bone or near the epiglottis, and can you swallow for me? Good. I see that both actions are within normal range and that they are both bilaterally going up and down. Next, we're going to go for the spinal accessories, which is number 11. And I'm going to place both my hands on your cheeks. Can you turn to the left for me? And the right? Perfect. So they are both displaying equal strength. Can I have you raise up your shoulders? That's perfect. So both of them are equal. And the last one, which is 12, which is the hypoglossal, I need you to extend your tongue for me and then wave it side to side. So you see how like the tongue is going equally? That's what we want to see, and that's also within defined limits. And out of the 3, motor, sensory, and reflex, I have chosen the reflex. Although I don't have the equipment with me, I do know where to place it. So in terms of the brachial area, you would have to tap right over here, and then that would elevate the person's arm up and flex. So that would be a normal reaction. Then for the tricep area, you would have to go right over here posteriorly. When you hit it, there should be a reflex that extends the arm. Now we're going to go to the brachioradialis. So you would, again, you would palpate and you would tap over here on the posterior part of the forearm, and the hand should extend upwards. Also next is going to be the quadriceps. Usually we would have to be on a higher elevated platform, but for today I'm just going to show you where it would be placed. So again, you would have your equipment and you would hit it right beneath the patellar, and it should extend outward for normal reflex. Right here we have the Achilles reflex, and you would basically hit it on the back side of the Achilles, and then it would go in this manner. So it would just be flexed upward. For the last one is the clonus. So what I have to do is I would actually hold the person's leg upward like this, and I would push against their plantar. If I let go and it's normal, it just falls back. But you know, there's no signs of abnormality that would indicate like it's oscillating back and forth. So in this case, it's normal. So it's just going up and down. And yeah, that concludes our health assessment review, and I hope you guys enjoyed.
Thank you.
Thank you.